Hey YouTube. Okay. Firstly, let me just tell you, I had my wisdom teeth removed a few days ago, so my face is I mean, it's not bad, but it's still a little bit puffy. I don't even think you'll be able to notice. I notice a lot, 'cause past few days my face has been all like, and it's been the worst. Anyway, I do have a couple updates, going on. Um, and I really need to make a YouTube video, and it's like 3 in the morning, but I went to work for the first time in a few days today, actually in like a week, and I had makeup on, and I was like, what better time to get on cam than when you have makeup on? Um, so there's a few things I want to talk about, but basically, I went to my family doctor last week, and I was like, hey, I'm transgender, oops, and I'm looking to start hormone therapy. And really, I was expecting her to not really know much about the subject, and her to be like, hormones for a boy, oh my. Um, but turns out she was like, oh, well, I have a couple transgender patients, and let me get in contact with them, do some research. Um, but in the meantime, let's get you started on hormones. And I was like, okay, awesome. So, I really wasn't expecting to start so soon. Or just like from seeing my family doctor. Like, the chances of you going to your family doctor and being like, I would like to go through hormone therapy so that I can look more like a girl. Chances of them being like, okie doke, is pretty slim. I'm not sure if she will. I mean, I'm sure she'll want me to see a therapist, but I don't know if she's like going to require me to go through therapy for this to happen. She started me on a prescription for spironolactone. I don't even know if I'm calling it that right. I know that for short we call it Spiro. That's what I hear everybody else calling it. It's a diuretic, so it's going to make me piss a lot. And it's mainly used for hypertension, but it's also used as an anti-androgen. Um, okay, the prescription hasn't gotten to my pharmacy yet. I'm gonna call her tomorrow and ask her why it's not there. Um, but I mean, she wrote me the prescription. She asked where my pharmacy was so that she could send it there. So I assume, um, I don't know what the holdup is. I think she wanted to get in contact with my dermatologist to make sure that the meds I'm on for acne and stuff are not gonna mix and kill me, or something. This is why it's good to have a doctor to monitor your blood work and stuff. So I don't know. My biggest fear is that she got a hold of like her trans patients. Did I just make up that word, trans patients? Anyway, her transgender patients, and they might have said, you're, Mitchell can't really start hormones unless he has consent from a therapist. I don't know. Um, anyway, I'm gonna call my doctor tomorrow, and soon I'm gonna start Spiro. And in this video, I wanted to talk about like a few things besides just that big update. And from here, if you don't want to hear anything about my life, I mean, that was the biggest update to really give, but I wanted to give a little information about hormones, which I'm getting from this nifty website called transgendercare.com. Um, and I didn't know about this website until a friend of mine from a trans dating site I'm on mentioned it to me. And it's awesome. It is full of all kinds of great information if you want to know anything about the transition process, medical, and it's mostly medical. I mean, there's, talk about guidance and therapy and surgical stuff, even electrolysis. I mean, all kinds of things. But I'm going to give a little information about the drugs that, at least I think I'm going to be on. I'm going to be on an anti-androgen and an estrogen, and I think the estrogen my doctor wants me to go on is estradiol. She mentioned estradiol. I think it's just a pretty generic estrogen tablet. Well, a little information on Spiro. Spironolactone. The drug most commonly used for the task of diminishing one's response to androgens is spironolactone. Like many other drugs in the category of anti-androgens, Spiro is used other than for its primary or generally intended purpose. In the case of Spiro, it is a diuretic and antihypertensive medication. Spiro is a good choice for an anti-androgen. It is generally well tolerated, even when administered over a period of years, and when, by happenstance, a mildly hypertensive patient enters into transgender treatment, often Spiro can be provided as a substitute. By doing so, the medication now serves a dual purpose. While Spiro is a potassium-saving diuretic, the normal monitoring of blood chemistry during transgender treatment assures its safe administration. So basically, it's gonna mess with my potassium levels a bit, so I'm gonna have to, keep tabs on my potassium levels, and hopefully I won't turn into a banana or something. I mean, that was a silly thing to say, but, I can't ever smoke ever. Not that I ever had any intention to, but if, I'm gonna, one thing that, I was kind of caught off guard with the fact that I'm gonna be starting hormones now. I thought this would not be something realistic that would be happening for like at least another 6 months to a year. But I have to, I gotta get on board with this. I need to consider, like, my diet, what I'm eating. I need to get more active, just because I don't want to, get all flabby and not like my body. Plus, it's just good to be active anyway. There's lots of research to do. And this website will be great for that, this transgendercare.com. For any of you trans people who might be watching this, you should definitely go check this out. Great, awesome, full of terrific resources. Okay, so a little information on estradiol for oral use. It provides the most potent estrogen available and is most commonly taken by mouth. It may also be administered by way of skin patch or injected into muscle, whereby the drug travels expeditiously, boy, I can't be reading things, through the bloodstream to the areas it affects or targets. Oral estradiol provides a very effective means of feminization. Its dosing and subsequent adjustments, like other medications to follow, is dependent on measured testosterone levels. The degree of feminization achieved, side effects, and other impediments to a healthy condition. Yeah. This site even gives, like, recommended dosages or, like, normal dosages given. It's definitely not meant to tell you, like, how you're gonna do this if you're gonna, self-medicate. And self-medicating is dumb. I don't care what people say. It's dumb to take any kind of medication without some kind of supervision. Because, I don't know. Like, awesome for those of you who are done it, and are doing fine with it. But really, don't get into no, it's just bad, And I'm super lucky that I have a doctor who knows about this sort of thing. I'm really surprised that in Columbia, Missouri, there isn't, like, not like a clinic, but I haven't been able to find, like, a gender therapist. I don't know. Maybe it's silly for me to think that Columbia, Missouri would have that, but it's not like Podunk Town. Okay, is this really 9 minutes already? I might do a whole nother video on other stuff that I wanted to talk about. In fact, I'll do that. But this video was just to say I'm going to be starting hormones, and I am going to be giving more updates and to show my progress. It's really exciting. I'm really excited, and I hope that my prescription gets into the pharmacy, and that this wasn't just like oh, my bad, we can't start you yet kind of thing. And if so, then I'll update and tell you how lame this video is. Anyway, thanks for watching, guys. Bye.